Managing recurrent malignant pleural effusion can be a demanding process, requiring patients to spend several days to a week or more in the hospital. The PleurX pleural catheter is the first device designed specifically for outpatient and/or ambulatory management of malignant pleural effusion. The PleurX pleural catheter is a 16 French silicone catheter with a unique valve located in the distal end. The valve prevents fluid or air from passing in or out of the catheter unless it is purposefully accessed. The catheter has large holes along the proximal end to promote flow. A polyester cuff is included as part of the catheter. The fenestrated portion of the catheter is placed into the pleural space. A short section of catheter is tunneled subcutaneously, with the cuff being located just proximal to the catheter exit site. The distal end of the catheter with the valve remains external and is used to drain the pleural fluid every day or two. Proper medical and surgical procedures are the responsibility of the physician. The following is a suggested placement procedure. See the instructions for use provided with the PleurX for more detail, including cautions and warnings associated with this procedure. Place the patient in a supine position. Identify the proper interspace for catheter placement. Prep and drape the patient's chest. Anesthetize the insertion site and tunnel track. Pass the 18-gauge needle over the rib and into the pleural space. Aspirate with the syringe to ensure free flow of pleural fluid. Insert a guide wire into the needle and pass the distal end into the pleural space. Remove the needle. Make a small incision through the guide wire insertion site. Make a second incision approximately 5 centimeters inferior to the guide wire. Attach the catheter to the tunneler. Pass the catheter from the inferior incision up to the guide wire site incision. Pull the catheter through the tunnel until the cuff lies approximately 1 centimeter from the inferior incision. Cut the catheter from the tunneler. Pass the peel-away introducer over the guide wire and into the pleural space. Remove the guide wire and dilator. Pinch the sheath closed as the dilator is removed to prevent air entering the pleural space. Continue to pinch the sheath closed until the catheter is passed into it. Insert the fenestrated end of the catheter into the peel-away sheath. Advance the catheter until all the fenestrations are within the pleural space. Peel away the sheath, taking care to keep the catheter in place. Adjust the catheter so that it lies flat in the tunnel without any kinks. Close the incision. Suture the catheter to the skin, taking care not to restrict the diameter of the catheter. Close the incision around the catheter. Fluid can now be drained from the pleural space. Care must be taken when draining fluid to avoid possible re-expansion pulmonary edema. Drainage volume should not exceed 1,000 to 1,500 milliliters. The fluid can be drained using either vacuum bottles or wall suction. Attach the 17-gauge needle to the drainage line if using vacuum bottles. Or attach the 5-in-1 connector if using wall suction. Clamp the drainage line fully closed and attach the line to the appropriate suction source. Remove the cover from the access tip. Insert the access tip into the catheter valve until you feel and hear a click. Release the pinch clamp. Fluid will flow from the pleural space. If the patient experiences pain, the flow can be slowed or stopped momentarily by adjusting the clamp. Remove the drainage line from the catheter. Clean the opened end of the valve. Place the cap over the valve. Place the catheter pad around the catheter and wind the catheter over the pad. Cover with gauze and secure to the patient's chest. Instruct the patient and/or the caregiver on how to use the drainage kits to drain at home.
Cardinal Health wishes to thank J.P. Putnam of the MD Anderson Cancer Center for his assistance in making this video.